welcome to Truth and Wellness. My name is Joan Warner and I'm your host. I have with me today Dr. Kelly Ferris from Knoxville, Tennessee. He owns 4 physical therapy clinics in Knoxville. Welcome, Dr. Ferris.
Thank you for having me.
I have to tell you that of all the fields, physical therapy is my favorite field because you guys got me up and walking after I broke my leg.
Oh, well, mine too. So I'm happy that they helped you.
So could you tell us why physical therapy is so important?
Well, physical therapy is sort of the right hand of the doctor. So when the doctor is dealing with you and trying to fix you up, we're sort of his helper. So we're right there to get you moving, restore your function, reduce pain, help with the healing. But we do it all with physical means. We don't use any medicines. Well, occasionally we use some of the medicines and some of the electrical stimulation treatments, but mostly it's using physical means to get you going again. And whatever is your deficit, if it's a deformity from birth, physical therapists are there from birth. If it's something that happens when you're 100 years old, physical therapists are there too. It's the whole life thing. We start from the very beginning. I've treated kids from 3 months old to over 100. So we treat almost every age, every type of disease. There's some aspect to it because we're working a lot with increasing your strength, increasing your mobility, being able to get around, whether you're walking or in a wheelchair or crutches, whatever, we're teaching you how to do that. If you're healing, like after a sprained ankle or after a surgery, we see a lot of post-surgery people, so we're helping you get back going again and aiding in the healing process there. Sometimes we'll use hydrotherapy or electrical stim to try and get the tissue to heal faster. So we're sort of involved in that, making that healing process faster.
Well, I wasn't aware that you used hydrotherapy in physical therapy.
Yes, we use a lot of hydrotherapy, heat treatments, ice treatments, whirlpools, hot and cold contrast. So yes, a lot of times before we'll do a treatment, we'll put ice on it so it prevents swelling. Then after the treatment, we'll put ice. For people, muscles trying to get healing, we'll use heat, hot packs, whirlpools, big Hubbard tanks for the burn patients.
A Hubbard tank?
Hubbard tank is a whirlpool bath that's the size of your whole body.
Oh, really?
So
do you typically start out with weights or bands or exercises or?
Well, it depends on what it is. We first start off with an evaluation, and it just depends on where that person's coming from. And if I know I had this one fellow, very severe back scoliosis. I mean, his back was like a complete S curve.
Oh, wow. He
could not do hardly any exercise. He couldn't hardly walk at all. So we put him on a mat and we just did some like very easy mat exercises, lifting his legs, lifting his arms and whatnot. And after a couple of weeks of that, he got where he could walk, so we started him on the treadmill. And the first time he walked on a treadmill, he walked 1 minute at the slowest speed the treadmill would go. And after a couple of months, he walked 30 minutes on a treadmill.
30 minutes? Seriously?
After 1 minute, yes. And that's where he couldn't hardly walk at all. So, yeah, you start at whatever they need to start with, sometimes just rolling, like with little children. You're doing rolling. You're doing just getting them to pick their heads up. With people just had a knee surgery, you're just getting them to just move their knee just the slightest bit to try and just get those muscles woken up again.
I bet sometimes they're not real happy with you doing that, huh?
No, a lot of times. But PT often stands for pain and torture. So, yes, we try and make it as painless as we can. And that's where like the ice comes in, and some of these techniques we have can keep it fairly painless. And a lot of the treatments, if we make them have pain, that's bad. That means that we're making them worse. So we need to have their pain. That's one of the problems in physical therapy, is people have come in with a lot of pain medication, and we don't know if we're hurting them more because they don't know if they have any pain or not. So we try and get them to cut down on their pain medication or go off their pain medication so we can make sure that we're not hurting them more. Now, if they have some pain and they need to exercise, yes, they need the pain medication before. And a lot of times we'll refer them to the doctors to get some kind of cortisone shot, like a lot of shoulder injuries. They can't move it. They've got to move it. The only way you get it moved, they get a cortisone shot where now they can exercise. And so we sort of have this whole progression of what we call passive exercise, where I am actually lifting your arm. That's passive. You're doing nothing. I'm doing all the work. Then you do active, where you start lifting your arm. That's the very beginning. You start initiating the exercise yourself. And then we will gradually add weights or bands or machines. You know, the better you get, the more advanced equipment we can use.
Is there such a thing as manual physical therapy?
Yes, manual is all those things where I'm doing it for you. I'm lifting your arm, I'm bending your knee. If you have joints that are frozen or scar tissue is built up, we'll do a lot of just hands-on, just manual, moving the tissue, moving the joint, either gently or forcefully as needed. Some of the knee patients, we had a patient come in, a total knee, was stiff. She couldn't get to her 90 degrees. Oh, wow. And so the doctor said, I want her over 90 degrees. And we really pushed her, and it was very painful. But we got, you know, her 110 degrees or whatever. And the doctor was amazed that he had no idea we could get that much because it had frozen up so bad. Most of the total knees don't have that problem. They get their 120 degrees quite easily. The doctors are getting better. The total knee itself, the implement are better. So we're seeing much better success in all these surgeries. The post-hip surgeries, post-back surgeries, neck surgeries. They come to us for their physical therapy and do very well and get strong and get back to whatever they were doing before.
Now, do all companies have manual physical therapists, or just certain companies?
Well, I think most therapists are trained in manual therapy. Okay. Most therapists and physical therapy assistants. Now, some of them feel more confident in it because you might go to a job where you do a lot of it, and the more you do, the better you get at it. If you're working in a clinic where there's not a lot of manual therapy, you might lose that skill after a while. Maybe if you're working home care or something, or I don't know, maybe you're in a burn clinic, or you might not do as much manual therapy.
What about scar tissue buildup? How do you handle that?
But like us in outpatient, we do a lot of that manual therapy, and scar tissue would be a big part of that, because whenever you have swelling, you'll get scar tissue. Because whenever there's a injury and there's swelling, that swelling has protein fibers in that tissue, and those proteins want to connect together, and that's scar tissue. That's adhesions. And you just have to break them up forcefully, either by bending the joint yourself or just manually getting in there and just rubbing on that scar tissue. And we have little implements. We have our elbows we'll stick in there to break up that scar tissue. You've got to get that scar tissue broken up as fast as you can. And to try and prevent as much swelling, because that just means more scar tissue forming.
Oh, I see.
So
it's a vicious cycle.
Yes, and you just need to be on top of this all the time. We have so many problems with people not coming for physical therapy till way late after their injury or after their surgery, and so much scar tissue has formed. They've had swelling and they've had pain. When you have pain, you get weak. So you have weakness, swelling. You can't do things. Your functional ability has gone downhill. So we're way behind the 8 ball. So we need to get started as soon as possible.
As you're increasing strength, what do you recommend?
Well, we sort of have our basic general exercise program where you try and build up to 10 reps 3 times, 3 sets of 10 reps, whatever it is. So if you're having a shoulder, we might, you might lift, do curls like this, 3 sets of 10. Or with the bands, out to the side, 3 sets of 10, and building up to this. So a lot of the exercise, there's different theories about it. You can use 6 reps of maximum, or you can use up to 10 or 20 or 30 reps, depending on what the joint is and how you're, the fewer the reps, the more you're working on strength, the more reps you're working on endurance. So you might have an exercise, like if you're doing for your legs, you're doing up on your toes. You can do that several times. You can do that like 30 times. We might do 3 sets of 30 for an athlete. Or we might have them run over cones or some kind of drill where you're getting hundreds of reps.
Now, that had me balancing on a ball, a ball. I had a ball underneath my foot, and I had to balance on one foot and hold out my arms and everything, just to get the strength up on one leg.
Yes, the balls, those are good to use because they throw your balance off. Therefore, you bring in lots of extra muscles, lots of accessory muscles that you wouldn't normally use. That's one of the problems with some of these machines, is when you do a machine, you're only working exactly one plane of effort, so some of these side muscles don't get worked as well. So when you use the Swedish ball or some kind of balance activity, it throws you off and you bring in lots of these other muscles that are hard to get at sometimes.
Why is movement so important?
Well, movement is life. I mean, no movement, no life. If you just think about everything we do, we want to move one way or the other. From a child, teaching the little babies, maybe with some kind of brain injury or handicap, just teaching them to roll over. And there's lots of ways you can just get them to move in ways that they wouldn't normally move. By rolling them, by putting them in positions, you'll get them to raise their head or move their arms. By turning their head, they'll move their arms certain ways. So you're getting them to move, all progressing towards trying to eventually get them to crawl, get them to sit up, get on their knees, get them to walk. So everything is sort of geared toward walking. Now, if you've had an injury where you're not going to walk, paraplegic or a spinal cord injury, then we're talking about getting you in a wheelchair or a walker or braces, something so that you can move as much as you want to move. And you see some of these athletes now, these paraplegics, they're skiing and water skiing and snow skiing. They're doing everything because they want to move. And we find out some kind of adaptive equipment to get them to move. We figure it out, whatever we can, as much as they're willing to do. I had a patient, he got bit by a spider as a young child down in Mexico. They amputated his leg. He went his whole life, he was 19, one of the doctors from a cardiologist was down there on a mission trip, brought him up so that we would fit him with an artificial leg. He was 19, he'd walked on one leg his whole life. So they brought him to a clinic, orthotics clinic. They fit him with a brand new artificial leg for free. And they called up the hospital and said, "We want your best therapist." So they sent me out there to teach him how to walk with this leg. He'd never walked with 2 legs since he was a kid.
Really?
So we started walking. He walked really well right away. We started walking upstairs. And in a few days or a few weeks, he was jogging on that leg.
No kidding.
Yes.
I bet he was thrilled.
He was thrilled, yes. He was just so excited because he could throw his crutches away. And he was a young, athletic kid, good-looking kid. And it was just exciting to see how much effort he put into, just getting to move again. Now, sometimes if you take an older person, their movement is going downhill, right? So what we're doing is not getting them to move more, we're just getting that gradual decline to be less so that they'll keep doing things for longer. And some of these serious diseases, muscular dystrophy or ALS or something, where you're going to decline. There's nothing that we can do about it. We just want that decline to be less, to be slower, gradual, so they'll keep moving for as long as they can.
Okay, Dr. Ferris, let's discuss modalities.
Well, modalities you usually think of as the things that are not exercise. So the hot packs and cold packs would be modalities. Also the TENS units and all the electrical stimulation units we use, those would be modalities. Also ultrasound, we have infrared machines, ultraviolet machines.
What do the infrared machines do?
Infrared is usually heat. It's a machine that just radiates heat. Some people, you can't put a hot pack on their leg or on their back because their skin is so sensitive. And if you want to heat that tissue up, you can do it without touching the skin with just these red lights. You've seen in a bathroom when you have that red light, that's infrared light, just a heat light, heat lamp. And now we have this machine called anodyne, which is a whole bunch of little tiny little infrared lights that we're using for diabetic neuropathy and some of the circulation problems in the feet and hands.
Right. Is it real effective?
Yes, I haven't worked with it a lot. So I have a machine, but we haven't had a lot of occasion to use it. So,
but the stats are high. Yeah.
So it's one of these new machines that's out there. Like there's like cold laser is the new one that's coming out. We don't know, some of the effects of these things yet.
Who thinks of these things?
Yes, these are, I don't know, people smarter than me, I guess. But the one other modality would be the electrical stim. And there's lots of different currents that we use in the electrical stim. Like for the pain problems, we use a lot of this current called interferential, which is several different currents coming into the body at one time. We put the little pads on you, send this current in, and it helps to take away the pain. Because it confuses the nerves. They don't know what electrical current, because the nerves are all worked by electrical current, so it doesn't know which electrical current to register. There's another one we use, we put on the ears, microcurrent. We use for fibromyalgia to try and stimulate the brain to secrete its neurotransmitters, build up its
Have you had a lot of success with that?
Yes, yes. That's one of the main things we use for the fibromyalgia. Fibromyalgia is a lot of everything's gentle. Gentle exercise, gentle heat, gentle massage, and this microcurrent we use for them.
I know a lot of people with fibromyalgia. A lot.
Yes, we're seeing more and more of that. I think with the fibromyalgia, it seems like what we're finding is people have just worked too hard and burnt themselves out. They've just gone and we just try and get them to slow down and rest. And there's drugs that are out, the Lyricas and all the gabapentins, because it seems like the fibromyalgia is, in some of the cases of fibromyalgia, it's not enough GABA that you're secreting in your brain. So anything that you can do to increase that, and so trying to get, just like a lot of these things are just people have burnt themselves out. A lot of depression, anxiety, pain problems, just overworked. We try and get people to, hey, not work so hard. Take a break once in a while. They're driving their brains so hard that they're getting all these physical symptoms.
Right.
I had this one lady, good friend of mine, her husband was the doctor, he was my supervisor, and she had rheumatoid arthritis. She'd gotten it at about 70 years old. I said, well, what made you get that? You live such a healthy lifestyle, you're a good-natured person. She goes, well, my mom got sick, and she came home to live with us, and I had to take care of her all day and all night. Yeah. And she goes, I knew I was going to come down with something. I was going to get a heart attack, I was going to get cancer, I was going to get, I didn't know what I was going to get, but I knew I was going to crash. And boom, one day, just instantly, arthritis over her whole body. Everybody has their weak link, whatever you do. So just as that's not part of physical therapy, we do a lot of counseling, though. You got to slow down, take it easy. Now, some people, we tell them, you got to do more. You're sitting around too much. But some people, they need to slow down. And
so if we go to physical therapy and we do all the exercises and we don't come home and do them at home, how effective is the physical therapy going to be?
Well, it's going to be quite effective in the one sense. A lot of our physical therapy treatments are 3 times a week. We just set you up 3 times a week, and 3 times a week you're going to get better. I noticed with if we start some of the doctors would order 2 times a week, they wouldn't get better near as fast.
Really?
3 times a week with that day of rest in between, they did much better. And then over time, when they were doing well, 2 times a week was fine. But some of these other treatments, if you do your home exercise, you get better so much faster. The home exercise program is just it makes the treatment so much better for the therapist, for the patient. I know, like with some of these frozen shoulders, they're so difficult to get that motion back after you get a frozen shoulder. It's almost completely dependent on their home exercise.
Really?
If they don't do their home exercise, they'll never get better. Because if we stretch them out 3 times a week for a half hour, that's not going to do it. That is not near enough.
Do you have those tuning forks where you
Yes,
the sound
we have.
forks?
Yes, we don't use those a lot much anymore.
They're not as good. They're not good.
Well, they're for very serious patients with nerve deficits and things like that. You know, so and generally, like me and my outpatient centers, we're seeing the mild people, you know, the total knees, the total hips, the back injuries. Yes, those are mild. That's not the spinal cord injuries and the head traumas, you know, that are very serious, you know, life-changing.
So how do I get into PT? If I wanted to take physical therapy, how would I do
Well,
that?
generally, your doctor will write you an order, and by law, we have to have a prescription from a doctor or a DO or a nurse practitioner or a physician's assistant, and we can see you. Now, a lot of people will just come into the clinic. They have a problem that their doctor knows about. The doctor hasn't written them an order, but the doctor might have said, you need to go for physical therapy. So when they come in, we'll do an evaluation, and on that evaluation is a line for the doctor's signature. So we'll fax that to the doctor, and he'll fax it back. That's their prescription. So they don't have to go back to their doctor when the doctor already knows they've had this surgery or they've had this back pain. And a lot of these people end up coming back several times. They'll come back, if like chronic back pain, which is very common. People come in for a month or two of therapy, then they'll be doing pretty well. They'll go several months or a year, and then back pain so they'll come back. We send off the prescription to the doctor, and he writes it, because it's just that way. You know, you can only go so long. You got to come back for another.
And what about the costs associated with insurance?
Most of ours is covered by insurance. And we see a lot of Medicare patients and that kind of thing. So we do some agreements for private pay people that don't have insurance. So our cost is about $50 for a private pay visit. And then whatever the insurance pays anywhere from $30 a visit to $80 a visit. That's sort of the reimbursement.
So, Dr. Ferris, we only have a few seconds left, and we would like for you to leave us with a few exercises.
Okay, let's do some exercises. Okay. All right. First one is up on the toes, back on the heels. Okay, you can hold on to the sink or the couch. Okay, the next one, knee bends, like this. Do, 30 of these a day. And then the next one, marching, like this. Okay, 30 of these. Okay, then for your hands, grab some weights. Some cans of beans, lift like this, okay? Shoulder shrugs this way, okay? And then get a band and do the rowing out and push. We can do push-ups against the wall like this to get those shoulders strong. You can do push-ups from the chair. Push yourself up like this.
Oh, that's interesting.
And then the shoulder shrugs. Did I say that one?
Yeah.
Okay. So that should keep you in shape.
That'll do it?
And if you're lying in the bed, you can do bridges and leg lifts.
Okay, great. Well, thank you, Dr. Ferris, for coming in and educating us on physical therapy. But before we close out, maybe you could give us a contact.
Well, thank you for having me. The web page is therapyplus-pt.com. You can contact me there.
Okay, great. Well, you'll have to come back and visit us again.
Be happy to, anytime.
Thank you for joining us, and we will see you next time on Truth and Wellness.
Breakfast. Are you one of those who just can't seem to face food when you crawl out of bed in the morning? Maybe a quick cup of coffee or tea, a donut, or maybe a sweet roll is your standard daily breakfast. In fact, statistics show that an increasing number of children arrive at school having eaten nothing at all. Astounding, isn't it? Why is it that most people skip breakfast? The most common reasons are they don't have time, or they aren't hungry in the morning, or they want to lose weight. Maybe they don't realize it's important, but eating breakfast simply makes good sense. Who would ever start on a trip without gas in their car? So why should you start your day without the necessary energy supply? A group of scientists spent 10 years studying the effects of eating breakfast. A good breakfast, they concluded, can help both children and adults be less irritable, be more efficient, be more energetic, and have better test scores. How? Breakfast provides a steady source of fuel to the brain, which greatly improves mental function and attention span. Studies have also even linked healthy breakfast with less chronic diseases, increased longevity, better overall health. Unfortunately, many people attempt to compensate for that mid-morning drop in energy by drinking coffee, tea, or a caffeinated soda, along with something sweet like a donut or a sweet roll or other high-calorie snacks. So what is a healthy breakfast? A good breakfast will provide at least 1/3 of the day's calories. It should be high in fiber and rich in vitamins and minerals. You may have heard the wise saying, eat breakfast like a king, lunch like a prince, and supper like a pauper. Good advice. Try starting your day with a whole grain cereal, whole grain bread, and a couple of pieces of fresh fruit, and you'll find that your energy level stays high all morning. Cereals, bread, and fruit are your energy foods. Carbohydrates, which are easily converted into glucose, are the fuel of your body. If you are eating low fiber and high sugar foods, they quickly pass into the bloodstream, giving you the high-low effect in energy level. A high fiber diet prevents too rapid absorption, ensuring a steady release of nutrients into the bloodstream. Fiber also absorbs water as it moves through the stomach and intestines, preventing constipation. And remember that fiber also plays a crucial role in weight control and in heart disease, diabetes, and prevention of cancer. If you are one of those who says you don't have time to eat breakfast, try eating less at night for your evening meal and then going to bed early so you can wake up refreshed with time to spare. Begin by drinking a glass or two of water and get outside in the fresh air for some active exercise, like a brisk walk. You'll come back after a shower and ready for a hearty king's breakfast. What more can you ask for? I want to thank you for listening. This has been a Health Tip Moment.